Something I've been seeing a lot lately is low back pain with patients. So one thing I want to shed a little bit of light on is two reasons why often people will have low back pain. And it can be one factor being lack of core engagement. So the body is all about calibrating stress that comes through the body evenly throughout the system, from the front and the back, side to side. And so if we look at the back, what is the complement to the back, especially the lower back? It'd be the core, the front of the body. This is one of the areas that often people will start disengaging from. And so the more we disengage in our core, then the more, for lack of a better term, dumping we start to get. The pelvis starts to tilt forward. This means there's more gravitational force being deferred straight into the low back. And so what then starts to happen is your muscles in your low back start to tighten and tighten, and they can only take so much force. So then what starts to happen is your low back starts to say, okay, well, my muscles can only take so much. Now, what else can I recruit? I can recruit the fascia. Now, the fascia is the network that surrounds all the tissues inside and outside your body, keeps everything connected. So after the muscles have engaged to the extent that they can, now they start recruiting the fascia. And so the fascia in the low back starts to actually thicken and tighten, and as it matures, this will perpetuate and become more and more of a problem. So as this area in your low back starts to tighten and tighten and tighten, now progressively this can lead to things like facet joint irritation, and in the long term even potentially shrinking you as a result of all this compression that's starting to happen. Because what do all these muscles attach to? Well, they become tendon and then they attach to bones. So now the bones start to really compress on each other, and that can lead to things like nerve impingement, facet joint irritation, things like this. So that's one of the factors, is disengagement in the core. The other common factor that I'm seeing a lot, especially with office workers, is tight hip flexors. So your hip flexors are made up of two muscles. You have iliacus and psoas major and minor. So iliacus is on the inside of your hip. That's not as big a player as psoas major. Psoas attaches to all 5 vertebrae in your low back from the front. So as you could imagine, if I'm like this all the time, then these muscles are getting adaptively shortened, and now all of a sudden I'm standing and walking. Now they're thinking, whoa, I'm being stretched, so I'm actually going to resist this a little bit. And so the more and more adaptively shortened my hip flexors become, the more and more stress is going to be put on my low back from the front. So some people have a combination of the two. The reality is, often low back pain, that's the victim, not the criminal. So again, the criminal is often either a disengagement through the core, specifically your TVA, your transverse abdominis, which helps recalibrate your pelvis, and or a tight psoas muscle. So just a little bit of food for thought. Take it for what it is. That's all I got to say.